We have breaking news from Eledon Pharmaceuticals today with a new press release they just put out about their type 1 diabetes trial. Today they reported that all 12 patients are fully enrolled in their trial with an average time since islet cell transplant of 8 months, and 100% of their patients who have been in the trial for over 4 weeks are off insulin.
Dr. Andrew Kudnick, biomedical research scientist studying the impact of nutrition and exercise for over a decade. That's a really important point. 4 weeks post-transplantation show the transplantation actually did stick within the body and was not immediately cleared by the immune system, and that they're insulin-free within that period of time. However, we know that most of these insulin transplant therapies, whether it be beta cell transplants or some form of insulin transplant into the body, requires months and months and months before they know if it works or not. 4 weeks is nowhere near sufficient anymore to see if it actually lasts long term.
So 10 of their patients are completely off insulin, and the other 2 are going to be off very soon. There was no graft rejection, and they continue to show a favorable safety and tolerability profile.
That's really important. When there's no graft rejection, it shows that if all patients adhered well to it, it's likely that in future trials that all other individuals may adhere to, or may not see that graft rejection as well. That's important. It shows that it's kind of ubiquitously effective, at least in these 12 individuals. That's key and that's important.
The 12 adults in their trial had type 1 diabetes for an average time of 33 years. Their average A1C altogether was 8.0. You guys, one of the most amazing parts about this trial, besides the fact that they're curing people of type 1 diabetes, is how quickly they're curing them. All of their first 10 patients, who are just 4 weeks post-transplant, had an A1C below 6.
So an A1C below 6 is typically a metric that most people are trying to hit with these transplant therapies. Although normal glycemia is less than 5.6, that's the true key biomarker of normal glycemia. Less than 6 is a remarkable achievement. But anytime you look at these curative therapies, there are a couple key things to pay attention to. One, was it universally efficacious? Number one, in this case it was. Number two, how long was it efficacious for? 4 weeks is nowhere near sufficient anymore. Sometimes we need to see up to a year post-transplant to really know if this is going to work long-term. No one's going to want to have a major transplant therapy like this without knowing that it's going to last them a year or more. And nor is any insurance company going to cover it unless they're shown to be that effective over that long period of time. Getting below 6 is absolutely obligatory for individuals with their HbA1c. And the final thing to always look for with these curative therapies is whether patients had to be on chronic immunosuppressants, which in this case they did. Why is that important? Because chronic immunosuppressants also come with their own long-term risk, similar to type 1 diabetes, right? So it's not a free trade. It just means that you don't have to deal with the burden of type 1 diabetes, but now you have to consider the burden of chronic immunosuppressants on your long-term health. Again, a real cure would be able to make patients get normal glycemia, be completely off insulin for the rest of your life, and not be on chronic immunosuppressants. We're not there yet, but we will eventually get there.